Lorri, thank you so much for taking the time today to speak with us about your journey. And we'd like to start with a bit of an introduction. So if you could go ahead and tell us a little bit about yourself.
Well, my name is Lorri Trosper. I am 50 years old. I am the mother of 3, the grandmother of 4 beautiful grandchildren. My life has never been easy. As a child, I had PVNS, which is pigmented villonodular synovitis in my right knee, and I went through a lot of childhood surgeries because of it. And as an adult, it turned into that I had something else that was rare called CRPS, complex regional pain syndrome, which unfortunately is the highest known pain to man.
Oh, wow. I didn't realize. Could you
Yes.
describe that knee situation that you experienced as a child? How old were you and what was it like?
My knee swelled up about the size of a volleyball when I was participating in sports in middle school. My dad took me to a doctor, and the first doctor did a surgery. They found tumors, but they couldn't figure out what it was. And then we went to a different doctor who again did surgery. We could not figure out what it was. And then we went to a third doctor, and I was 13 at the time. His name was Dr. David Mccarty, wonderful doctor, who actually figured out what the problem was. I do remember before surgery, overhearing the doctor tell my dad that they might amputate my leg because of it, because they kept reoccurring. And at that time, they didn't know, but after surgery, pathology was able to figure out what I had, and it's a very rare giant cell tumor of the tendon sheath. It can affect any joint. Mine was my right knee, which what they would do is they'd do a synovectomy and go and take the whole synovium out. Before the age of 18, I had 8 knee surgeries, all synovectomies, some of them open, some of them arthroscopic. I had a synovectomy at age 21, and then at age 26 I had another one, and then I had radiation for 30 days, the highest dose at the time that I could do, and then it put it into remission. My knee from the damage was the knee of a old lady, but I wasn't able to get a knee replacement until the age of 44 after fighting.
Wow.
Because it also erodes the bone.
Oh my
So
goodness.
I got that taken care of, and 5 weeks after my knee replacement, I was rear-ended by somebody texting, and that started a whole new situation. I had a total of 3 neck fusions, 2 in one, and then another one after the first 2 because it made the bottom one go. I had a fusion in my back, L4 to L5. And what I didn't know, and it took 3.5 years to figure it out, 5 days after the car accident, I had a partial shoulder tear that was discovered before my knee replacement. I went to my shoulder doctor and I asked if he would sign a paper to give me extra time to type because I was taking online classes because my right hand had all of a sudden went weak, which if I knew what I knew now, I would have known that was a sign. And then it went to my shoulder, again, thinking it was my shoulder. The pain was more than what a partial tear should cause the amount of pain. So he diagnosed me with a frozen shoulder. I now know that's not what it was. It was that it started in my hand and spread to my shoulder. I just kept having surgeries, fixing everything, and everything kept getting worse and worse. But I always consistently complained about my hand and would bring up my hand at doctor's appointments. Like it felt weak or it had a mind of its own. I had a picture I showed my doctor with a cut up hand because it had moved and broke a glass and it was all cut up. And, I remember them telling me that shouldn't be caused by my shoulder. A lot of things that I wish I knew because I think I could have got diagnosed quicker. Unfortunately, with CRPS, you have a 3 to 6 month window to stop it and put it in remission. In the beginning, it was 3.5 years out before I got the diagnosis of my right upper extremity, I should say, but it started in my hand. And then I was shocked with 220 volts of electricity, and it spread to my whole body. So I have full body CRPS.
And that shock was an accident that had happened, or?
It was caused by a dryer.
Oh no. Okay.
Yeah,
Okay.
so I got shocked, and I have 2 implanted nerve stimulators. At that time, I had 1, and it actually blew out my implanted nerve stimulator, and I had to have surgery to replace the lead that burned out. And then at that time that they did that surgery, they put in the cervical one because the lumbar was the first one. So
Sure.
I have 2 implanted nerve stimulators.
So you had a car accident, and it took 3.5 years from the time of the car accident to get a diagnosis
Of it
of.
just in my right hand.
Yeah.
Now, it took 6 years to the day of the accident, which was February 17th of this year, to determine that it had spread to my full body because I was having trouble swallowing. I was having trouble with my urinary tract, my gastro problems. My liver was enlarged on a CAT scan. I am not a drinker at all. And finally, my doctor, who's been great through it all, but he's a family doctor, sent me to a rheumatologist because he couldn't think of anything else to test me for. And I went and seen the rheumatologist, and well, you don't have anything rheumatological, but you do have a spread of the CRPS to your organs in your body. So it's called central sensitization, I believe, when it goes full body.
And what's the prescribed management at that point, or what's the recommended management after it spreads to the whole body?
There are no FDA-approved treatments for CRPS. I can tell you what I have tried. So during diagnostics, in the beginning, I was doing stellate ganglion block. I also presented with the telltale signs by the Budapest criteria. I lost all the hair on my arm, my nails changed, my hand was swollen and red compared to the other one, excessive sweating from my neck. I ended up having to cut, like, my hair has an undercut because it sweats back there. The region is, this whole region, so that's where the sweating comes from. So I had all the telltale signs according to the Budapest criteria. The stellate ganglion block is what is solidified it, I guess, for my doctor. And then that's when we put in the cervical. We were working to put in the cervical after we had the actual diagnosis.
Living with some pretty extreme pain, what were you doing to manage through, and how did you cope?
I had a lot of surgeries. I've had 39 surgeries. Everybody's like, oh, if we fix your neck, it'll fix that. If we fix your back, it'll fix that. If we fix your shoulders, it'll fix that. If we fix this, it'll fix that. If we give you these cortisone shots or steroid shots, it'll fix that. We'll do radio frequency ablations, it'll fix it. We'll do physical therapy. I did everything. I never turned down anything because I wanted life. I have very little quality of life anymore. Today I had to drive to North Aurora, which is 55 miles from my house, to go to a doctor's appointment. And that kills me. It kills me. I mean, I'm still in the vehicle, obviously, but that, driving kills me. I used to drive nonstop 30 hours to Mesa, Arizona, to Kissimmee, Florida. I would do nonstop. Now I'm traveling to Utah for ketamine treatments because it's the only affordable place that I could find it that was within my budget. And it's not even a budget. I had to take a loan from my family. And the worst part of it is I dread the drive. It's 19 hours to drive there, and I allowed myself 4 days because I'm really afraid I won't make it.
Sure.
And I have to drive. I have to drive because you're supposed to have somebody to go with you, and I don't have anybody to go with me. So the only way that they would allow me to do this is we're going to turn my minivan into a camper, and as soon as I'm done with my ketamine, they're going to help me into my van to sleep it off. That's the only way I can make it work.
And it sounds like they have the rules around driving after treatment, and so that makes it very difficult.
I'm just thankful that they were willing to work with me, and they were phenomenal at that. They normally only do it every other day because I'm coming from out of state. They're going to do it every day for Monday through Friday. So I get the 10-day start, which is to basically factory reset your your nervous system, because that's what's basically attacking you. So then I'm going to follow up with maintenance doses here. I just couldn't afford the 10 here because it's a lot more expensive here.
Got it. And it takes a lot of time to research all the different places you could go to get the best
Well,
treatment.
I went state by state. I've signed up for every clinical trial that's come around. I was able to convince a doctor to give me Lotus Naltrexone, which Stanford University is currently doing a trial on Lotus Naltrexone, which is usually used for alcoholics and drug addicts. But at a low dose, it can trick your mind to not feel the pain. I didn't have the availability to drive back and forth to Stanford, and my doctor that did my surgery, I just had surgery in May to move my batteries for the 5th time of my nerve stimulators because my body doesn't like them apparently. And they let me try the 90 days of the Lotus Naltrexone. It didn't work. It was given orphan usage to treat FDA, or by the FDA to treat CRPS. It didn't work for me, but at least I can say I tried. I'm always willing to try everything. But I think I'm at a point in my life with having 39 surgeries and 5 of them just because batteries migrated that I can safely say I do not want any more implanted devices.
Sure.
More trouble than the work.
Could you describe the process of getting the devices implanted and whether or not they worked at all for you, or have they worked at all?
Well, when they're working correctly, because I've had like batteries migrate, rip out wires from my spine. I've had batteries migrate where they're leaning up against my sacroiliac joint and causing all this problem down my leg. I had one migrate behind my spine and I couldn't even lay down or lean back because it was right behind my spine, between the skin and the spine. So if I put any pressure, it would push it into my spine. As far as spinal cord stimulators, this is what I can say. If you are within the first 3 years of getting CRPS, absolutely look into it. The process is you have to meet the criteria, then you have to go through a trial. Now, different companies have different requirements. Mine required a 7-day trial where they took me into a procedure room and through a fluoroscope, they installed the wires into my spine, which came out and was attached to something that was on my hip. And if that showed at least 50% improvement, then they went ahead and scheduled the surgery. I've had a lot of surgeries. Surgeries don't bother me too much. Shoulders, don't do shoulders. Those 2 were the worst. But as far as the spinal cord stimulator, the worst part about surgery for me was you have incisions on your back. I had incisions on my butt cheek. So when sitting was hard, laying was hard. I slept in a recliner the first week and a half, 2 weeks. You can't bend, lift, or twist, which, believe it or not, is pretty much everything you do. It's just being careful, because if you rip them out, you're having surgery again. That's all I can say is be careful, prepare to be uncomfortable sitting and laying, invest in a recliner if you can, because it's going to save your life. And if you're past 3 years, I wouldn't recommend it, because a lot of research has been done, and they say once you're past 3 years of diagnosis, it really isn't that helpful. So my lumbar was 3 years, was before the 3 years, and my cervical was after the 3 years, and my lumbar works way better than my cervical.
Okay. So you can tell the difference in between the two. And when it does work, let's say your baseline level of pain, I don't know what that is, but how much
right
improved?
now my baseline is 8 with them on.
Oh wow.
It's that bad. If I start feeling really bad, the first thing I do is check my batteries to make sure that I did not run out of battery, because a lot of times those are the days where I can't take it. And it takes up to 12 hours, 12 to 24 to build up in your system again. That's another thing. Make sure you're on top of your batteries. I get sidetracked or I forgetful because it does cause a lot of brain fog. And occasionally they'll go dead, and I pay for it. I do. I pay for it when I don't pay attention like that. And it's not because I don't want to. It's just because life.
Sure. And how often do the batteries need to be charged and that kind of thing?
Well, my lumbar has 2 wires, 2 leads in my spine. So that one drains a little faster than my cervical, which just has 1. So every 48 hours, I would say I charge my lumbar. And then every 48 every 3 or 4 days, I would say my cervical gets to the point it needs to be charged. I try to do it when I'm sleeping or laying down or not going to be moving, because it literally has to be contacted. I mean, it just lays against your skin. And every time you move, if it loses signal, it's going to beep at you. So you want to be like where you're not going to, and use the bathroom before you put it on if it's low, because you're going to have a trouble and you're going to have to refind everything and unconnect it. But it's not hard. Just know that anytime you move, it's going to make it difficult.
Sure. And you mentioned having to, or the leads that move, and you've had to have the surgeries to fix where they move to. How often would you say that happens in the course of a year or 2 or 3 years?
I am not like everybody else. Let me just put that make that very clear. I have ripped leads out and didn't know it. And my doctor says, I don't know how you didn't know it. Because before this, I had an extremely high pain tolerance. I lived with pain all my life, and acute pain does not affect me. It's the chronic everyday pain that affects me. So I have extra anchors because of my pain tolerance, I guess, for acute pain. And they stay in place. But while everything is healing, you got to be very careful the first 4 to 6 weeks, I would say, after surgery. Be really careful, because you don't want to move them then. My problem isn't moving the wires. My problem is the batteries migrate. I think it might be just me trying to reject them, because I just had one May 17th. I had one before that in June 16th of last year, November 16th of the year before, December 3rd of 18, September 10th is when I got it originally put in. I mean, since September 10th of 2018, I just had my 5th surgery May 17th for them.
And well, so they help, right? Otherwise, you wouldn't be going through it.
They do help, but when they migrate, migrating them can pull out a lead, because I've had that happen. Or if it migrates like behind my spine, which it did one time, that was the worst time of my life. That I would not want to go through again. When it was migrated up against my sacroiliac joint, caused a lot of problem with my right leg. This doctor, I had a new doctor that did it this last time. He actually sewed the batteries into my muscle, and he moved from my butt cheeks, like where I sit on them, to above. So I'm not like sitting, because I do move a lot because of the pain. I'm always like on one side to the other to relieve the pain. So I try to be conscientious of them now, which I can't go through another surgery. It's just too hard on me anymore. I went through a lot. I don't know. Now it's different. I went through 4 surgeries in 5 months and was fine. Now I have one and I'm down for 6 months and don't want to do anything,
Sure. So it's been 6 years since the accident.
It's been over 6 years, February 17th to 15. So it's,
okay.
Yeah.
Yeah. Over 6 years since the accident. Were you working before the accident, and were you able to continue working after the accident? And are you working now? Has it impacted your?
I was actually driving for Uber when it happened. So I was working. I was in the commission of a fare when I was rear-ended. I had 2 passengers in the back of my car. I worked my life. I worked for Verizon. I was a district manager. I was an area manager. I mean, I ran stores. Senior sales and operations manager. I had great jobs. After my knee replacement, I couldn't do all the standing, so I started driving for Uber, because that was something I could do. My second day of driving is when it happened.
Oh.
I continued to work for maybe 3 or 4 weeks, and it just got so hard that I couldn't do it anymore. And at that point, we didn't know. What was going on. I just kind of quit. And then I sold insurance. I'm a Medicare specialist, or I used to be, I should say. I'm not anymore, but I would do little stints of 1 or 2 months selling insurance, but it always got too hard, and that's all I could ever do. And then I finally stopped. I've been fighting Social Security for years for what I paid in for all my life, in case I had a disability that stops me from working. And now I have a disability that stops me from working, and I have had been turned down. I have sued them in federal court. I have gotten remanded back. I try not to give up because this is what I worked for all my life. I mean, it's sad. It's sad because I see a lot of people out there that don't have it nearly like I have it, and they don't have any problems. It's just frustrating, you know. And I'm a smart woman. I mean, and I think that is used against me because I am a smart woman. I have 6 patents. My last denial mentioned that I had 6 patents. Okay, so yeah, I have 6 patents. But if I physically can't do anything to bring them to fruition, they're nothing.
Yeah, no, absolutely, absolutely. The pain is real. It's there. It's with you every day, and you have to manage through it. And it's difficult, and it's a full-time job. You had to drive many hours just to.
I had surgery in another state because my insurance didn't cover it from anybody around here. I mean, it's rough. Everything is rough. They don't make it easy on anybody that's sick anymore. They really don't. And I would love these there's good doctors and there's bad doctors. Let me just make that very clear. I have a lot of good doctors, but I've also dealt with a lot of bad doctors. When you go in there and, you know, like I went to the doctor today. I brought in, this is understanding the pharmacologic therapy for patients afflicted with complex regional pain syndrome. I wanted to go through this with my new doctor, and they allowed me to. So this is a good doctor to say, this is what they recommend. I've already tried this, and this, and I tried this, and this, but I haven't tried this. You know, they always think you're there drug seeking. I don't even like to take opioids because I build up a tolerance for them so quick. It's just not worth it. There's other things, you know, that I've tried. The ketamine, I'm getting ready to try. I did talk to him today about ketamine troche, which is a sublingual that is used when you're in a flare-up. Today I'm in a flare-up. I don't know if you can see in this light, or if it's even still happening, but this hand was severely red and this hand was white at the doctor. I don't know if it's still showing that way. I can't tell in the sunlight. So she knew I was in a flare-up. It was very obvious because, you know, it's color change, it's inflammation. But she's unfamiliar with it, which is fine. She was a nurse practitioner I talked to, but she said, I'm going to talk to the doctor and ask him about that, because that is something that, you know, is recommended for during flare-ups. I'm tired. Insurance companies treating medicine or practicing medicine telling me I can't have, for example, Savella, which is another thing that's used to treat CRPS, because I haven't tried everything else. So right now I'm taking nortriptyline, and I have to take it for 90 days. I always have to jump through hoops to try something when usually, I mean, I'm very non-responsive to a lot of medications. I had a gastric bypass, so I don't absorb correctly. So I have issues, you know, with certain medications not working for me. That's why I thought the sublingual would be good, because it's a brain blood, you know, it gets into your blood very fast. It doesn't go through your stomach system, your gastrointestinal system. So, you know, I have literally walked out of doctor's appointments because they treat me like a drug seeker. And I'm like, I didn't even ask you for anything. I didn't ask you for anything, you know? Sure. And I deserve to be treated better than this. I am not like the regular person. I stand for principle, okay? Sure. Yeah. I educate myself on CRPS like I'm a doctor, and I've been confused as a doctor by many people, or what part of healthcare are you in? I'm not. I have to learn my illness because doctors don't know about it. I have to educate doctors about it. That's the biggest thing about this is a lot of doctors don't know about it, or they've never seen it, or they've never treated it. It's rough. It's rough. I'm just thankful I can advocate for myself, because I know me being able to do that is good. And I know there's lots of people out there that have no idea how to do it for themselves. I really do. And it's sad because I wish I was in better shape, because I'd advocate for everybody if I could, you know.
Yeah, and that's part of you sharing your journey here today. You know,
yeah.
there are others out there who are experiencing what you're experiencing, may not have the ability or the facility to do what you've done to be able to manage through, who need words of encouragement, which you're providing, but also just need to understand that it's not them, right? It's not their fault, and
No,
that there's
no. And we all go through it. I went through I have the greatest mental health care team ever, ever. And everybody says, "Oh, it's in your head. Oh, you're depressed. Oh, you got anxiety." And I tell them, I said, if you don't treat my pain, I will never not be depressed. It's always going to be there because I am grieving myself. The person I used to be, the one who went on vacations with my kids and drove for hours, the one who could babysit my grandchild at the time. I only had one at the time. And pick them up. Now I can't do those things. It just, you go through the process of, is it in my head? Am I drug seeking? You start to second guess yourself because you go through so much and you hear so much about how it's in your head, how they can't find anything. Read your charts and it says exacerbation of this or psychosomatic of that. You know what? I'm not crazy. I'm not. I'm just too smart to live like this and to see them treat me like this, that I refuse to not fight for myself. I literally am advocating for my life every single day, And I'm willing to help anybody. If anybody wants to email me, I will help. Things I can do. I don't really go anywhere but doctor's appointments. Like I said, I pulled over because I was a little later than I thought because I actually had a doctor that listened to me today and it took some extra time. But I will answer questions. I will give tips and tricks. I will, whatever I can do to help somebody from the safety and comfort of my own home. Sitting upright like I am right now is besides standing, my most uncomfortable position. I sit in my recliner or lay in my bed a lot just because that's where I have the least pain. I have a service dog. A service dog is great if you've got CRPS. Because I walk with a cane prescribed to me. In my house, I don't have to. It is prescribed to me because CRPS causes autonomic dysfunction. I have orthostatic intolerance. My blood pressure is really low. And when I'm standing, I have vasoconstriction in my legs and the blood pools, and it makes me dizzy, and I can pass out. And it's been there for a while, but I didn't know what it was. In the house, I know where I can sit. I know where I can grab onto. I have my service dog who's got a handle on his harness, so I don't have to use it in the house, fortunately. But anytime I leave the house, I have to use it because I don't know where I can sit. I don't know if I start to get dizzy if I use my cane, if I'm going to be staying upright. And it's scary. It's scary to be out in public and worry about people bumping into you, knocking you over, getting a dizzy spell, passing out. Hitting the ground alone could do a lot of damage to me. I wear long sleeves because the wind hurts me. I have allodynia. I lost all the hair on my arms. Can no longer wear a bra and underwear because they're too tight. I can't have anything tight. Everything I wear has to be soft. I can't wear jeans anymore. I don't buy anything unless I know it's something that my skin can handle. And it's rough. It's rough. I had to change everything about my life because of this. And I didn't understand it. Now I understand it because now I know what it is. But it's really scary when you don't know what the heck is wrong with you and all these things are going crazy and it doesn't make sense. It really doesn't make sense until you get that diagnosis.
What was it that finally was the breakthrough on the diagnosis? What was it that?
Me.
How did that happen?
I was going to my family doctor, and I had been going to him for years, complaining about my hand. Like, it's swelled up, it hurts. And they said I had arthralgia, which isn't even arthritis. They tested me for all the autoimmunes. I never had a positive ANA. They tested me for everything he could think of. And then one day I started making a list of what I thought were symptoms. So I decided to put in there that I lost all the hair on my arm. And then I thought, well, past menopause, because every time I brought up the sweating, it was menopause. I had the sweating. So I added those to symptoms. And I went to Mayo Clinic and they had a symptom checker. So I put in everything I thought that could be a symptom, and it brought up a list of things. And I actually have a screenshot of it somewhere. I could probably share it with you. And we had checked for everything except for CRPS on that list. So I went to my doctor and I said, could it be this? Here it is. Look, we've tested for this. We've tested for this. And he says, I don't know much about it. Let me send you to a different doctor, a physiatrist. So he sent me to a physiatrist. That physiatrist asked me what I take for pain. And I said, I don't take anything for pain. I only took opioids after surgery. But after I got shocked, I did take them for about a year and a half straight because it just went crazy. I don't take them now. Sometimes I wish I took them now on the bad days, but I'm leaning towards the ketamine because the opioids just stopped working for me real quick. So I went to Dr. Painter and he said, what do you take? And I said, well, I don't take anything for pain unless I have surgery. And he said, you're not taking Lyrica? And I said, no, I'm on gabapentin, but I've asked for Lyrica, but they keep telling me it'll never get approved. My rheumatologist I had at the time, and I complained to them about my hands. They said I didn't even have fibromyalgia. It's like I complained all the time. I really did, and they just never listened to me, and that's really upsetting for me because I just wish I could have caught it quicker and maybe changed my life around a little bit. So Dr. Painter, back to that. I'm sorry, I got sidetracked. He says, well, you need to be on Lyrica, and I told him how my rheumatologist would not even prescribe it because she can't get it approved. And he said, well, when do you see your pain doctor? Which is the doctor that did my implanted nerve stimulators. He's an anesthesiologist / pain doctor. It wasn't like I was taking opioids at the time. I was going to him for surgeries and shots and epidurals and all that stuff. So I was seeing him the next day. So he sent a letter through the charts to that doctor. I went to that doctor the next day. And within 24 hours, I was on Lyrica. Within 24 hours. I think it helps. I'm not sure I'm on the right dose, but this is as high as they would go, which is 150 twice a day. And I know that they recommend for some people like me, 300 milligrams twice a day. But my insurance company, like I said, they practice medicine. They dictate what you can take, even though your doctor prescribes it. Said no, they'll only go up to 300 max a day. So that's what I've been on for 3 years.
And you think it's helping, but probably not enough because it's probably sub-dosed inappropriately.
Everything I take has to be at a higher dosage because of the gastric bypass and malabsorption issues. And I really think I'm underdosed. But my insurance company is dictating how much I can take. So I'm kind of...
and clinical trials don't take into account...
That's why when I print stuff out, I print it out from the NIH, Medscape, like doctors' pages. I don't just print everything I see. I do the research. I print out verifiable stuff. And I either get one or two things. One, they're intimidated by me. I get that so many times. Don't be intimidated by me. Talk to me. Listen to me. That's all I'm asking. I'm bringing proof. I'm not just spewing off the top of my head. Or two, they think I'm drug seeking. And it's never about that. Literally, if you've seen when I circled in this right here, carbamazepine, I don't even know if I'm saying it's an anticonvulsant that's been known to show improvement in pain. Just things I haven't tried that are not even a controlled substance. But they don't even listen to that. They just assume.
That's terrible.
It makes me mad. It really makes me mad.
Yeah. And unfortunately, this is a very common situation.
Oh, I know it is.
Where we are talking to our clinicians and they're not hearing it, or they're seeing what they want to see, which is unfortunately not the case.
Oh, so, yeah, like me telling my doctor that my pain is 8, which is all I've ever said for the last couple of years, and then it says 6 in the charts. Or like today, I noticed 2 things in my chart just from my appointment today. that were incorrect. I said I was in an accident on February 17th of 2015. I was rear-ended, and she put in 2017 I was rear-ended.
Oh, geez.
So that has come back to bite me with Social Security. You know, I have a lawsuit going on. I have to be very careful for their mistakes, but then you always hear they don't mischart stuff. I cry foul a lot, and I make them change stuff because I pay attention. I do.
Well, and
that's what everybody should do. You should see your charts, whether it's digital or whether it's whatever, and you should know what the doctor's saying about you. You should know what they're putting in there incorrectly. I fought for years, and I'd show my doctor, do you see this hand is red? I don't know if you can see, but I would say, do you see this hand's red? Do you see this hand's white? Can you please put it in my charts? That is like the number one thing that points out, I can't even tell. It's the sun. The sun does something that I can't tell, but I think it's still red. The number one thing is, you know, people look for, but it only happens when you're in a flare-up, is the red inflamed hand arm. And when it happens when I'm at a doctor, I always point it out to them and ask them to put it in the chart. And yet again today, it wasn't in the chart. I don't understand why, when I specifically ask them, because I think it would make my life easier. Would you please put this in the chart so it makes my life easier? And then they don't. It's like a slap in the face, because then next doctor you see, you have to go around again. You have to, you know, I don't have it today, but I do have it, you know, but there's no reflection of it in your charts anywhere, even though you've asked hundreds of times.
Sure. And you know, maybe one of the benefits of doing this interview is maybe have them watch the video and they'll see the journey that you've been on and the things that you've experienced that bring you to the place you are today. You know, clearly, you know, from our conversation, the things that you've done have gone above and beyond what should be asked of anyone, let alone.
Because I want to live. I want to take care of my grandkids. I want to be a normal human being again, even if it's limited. I literally get 137 hours a month for a PA to take care of me because I can't take care of myself anymore. I don't want to be that person. I don't. I want to be independent like I've been all my life. That's the hardest part. It's depending on people, especially going through a pandemic, because boy, did I find out a lot during this pandemic of, you know, how hard it could be.
So, you know, your children, your grandchildren, how do they respond to what you're going through? What do they say, and how do you speak to them about it?
Oh, they know. I'm a burden. I'm a faker. I started using my cane. I got my cane after my knee replacement, and after I was shocked with the 220 volts of electricity is when the dizziness really got bad. And I started using my cane at that point. And you know, they used to make fun of me. They used to say I was a faker. My granddaughter, my 8-year-old granddaughter, she's great. She's very helpful. But my kids just refuse to see me as not the independent, tough person that made sure no matter what, everybody was okay. And now I can't make myself okay. And I don't think they get that. I really don't. Because I still am the one that makes sure everybody's okay, you know, but I can't make myself okay.
And you're doing this not only for yourself to live again, as you say, but also for them so that you can be there for them. And it's a hard journey and it's a noble one. So that you keep fighting for yourself and advocating for yourself is very admirable.
But let me tell you the other side of it, okay? I have already looked into physician-assisted suicide. Not death with dignity here in the States because they won't allow it for chronic pain. But in Switzerland, Dignitas, I've looked into it. They will do it for chronic pain. That's there because I don't know if it's going to come to a point in my life, but I do have times where I think I can't do this anymore. I do think that actually more frequently than I used to. I know I have something to fall back on. I've literally tried the majority of the treatments out there for my disorder. I have not tried ketamine, urandric acid, which is world-renowned in the Netherlands. It's their optimal treatment. It's not available in the United States except for one place, and it's $25,000. So I know that's off the table. IVIG, I haven't found a doctor that can get that approved. That's another thing that can treat me. There's things out there that I can't afford. I can't afford them. That could help me. And I'm not saying they will, because a lot of things haven't. But I'd like to have the opportunity to say I tried them. But when they make me fight for years for Social Security and I still don't have it, I don't know how they expect people to survive. I really don't. I really, really, really don't. Literally, I'm signed up to get notified of any new clinical trials. I'm not afraid to be used as a guinea pig. I want to have some semblance of life, because what I have right now is not life. It is hanging on by a fraying thread. And I just hope the ketamine is going to be the thing that puts me in remission, because there's so many people out there on forums that have talked about it being a godsend and how they wish they would have done it sooner. You know, and I've been since February trying to get this. And thank God my aunt and uncle are borrowing me the money because they believe in me. They believe in me. And I at least get to say I tried it, because there's really not much else I haven't tried that's affordable to me. But I do have that to fall back on. And I won't do it myself because I'm too smart for that. But I will do it with a doctor. I mean, if we can euthanize dogs and cats to put them out of their misery, I'm in misery. I don't see why it can't be looked at the same way. I have no life, really. And what I have is miserable. And I'm trying so hard to make it better, but I hit all the breaker walls every time. I don't even like to get excited about anything anymore because the letdown is so hard.
And you continue to fight, and, you were taking care of your mom as well. That must have been
I was doing what I could. I mean, I wasn't able to do everything. Couldn't change her. I did years ago, but, my brother helped. My brother has been a believer in me, but even sometimes he doubts me. I mean, I just, and I know, at least I hope and pray that they never feel pain at this level. Never. I would not wish it upon anybody else. But I mean, it's from skin, it's from joints, it's from muscles, it's from everything. Everything hurts, and it's nonstop, constant. And I don't think they'll ever understand unless they feel it, and I don't want them to feel it.
That's the thing that I reflect on as I have conversations like this one, is we don't understand unless we've experienced it ourselves. And part of this is not for me to understand. This is not for me to understand what you're going through. It's for someone else who might be going through CRPS or
yes,
something.
Or maybe thinking this could be what it could be. Because if I knew nothing about CRPS until it popped up in the symptom checker on Mayo Clinic. I knew nothing about it. And even then, when I was first diagnosed with it, I didn't do the research that I've done now, because it has took over my whole life. I wish I would have done the research back then. Maybe I could have done things a little different. I don't know. I mean, there's a lot of what ifs, and if I would have done this and if I would have done that. And I got to stop thinking like that. I'm the most positive, negative person you'll ever want to meet. That's all I got to say. I try not to be negative, but my life is a lot of negativity. But I try to be positive, and I really hope that at least one person hears my story, or I don't know if they'll have a way to message me after this. I could help them in some way, shape, or form so that my life has meaning.
Absolutely. So, Lorri, I wanted to thank you because you've shared so much. Your journey is so hard, and it's still hard, and you continue to fight. What advice do you have for others on their journey, either the beginning before they get into it, or they've lived with it for many years, as you have? What are the things that you tell them?
Never stop advocating for yourself. Do not be intimidated by your doctors, because they don't know unless you see a specialist, and even then specialists don't know. Do the research. Find out what's best for you. Never give up, even though sometimes it feels like you have to, and I go through that myself, but I still bounce back, hold myself up by the bootstraps, and continue. And if you really, really believe in something, don't take no for an answer. I had to fight tooth and nail to get ketamine used as part of my anesthesia for my surgery. And I mean, it was a big fight to where the doctor told me I'm the doctor and I have the degree and that's why. And I'm like, great, then you know the anesthesiologist. Ketamine is World Health Organized core medication for every trauma center and surgical center. So it's already used during surgery. So what's the hurt? How is this going to hurt my surgery by giving me ketamine? If you could tell me there's a reason why it would hurt it, when all the experts and the clinical trials are saying that ketamine stops the spread. I don't have it in my legs that bad. I don't know if it's from my nerve stimulator or if it's just it hasn't got that bad down there. I do have some symptoms, but not all of them. I don't want to get to that point where I can't walk. And I won. I mean, I don't want to even say I won. I was able to convince this doctor that what I was asking for was not ridiculous because it's already part of anesthesia. Don't give up. Don't give up if you believe in something, because it's your life. The doctor's there to help you. And if they're not going to help you, find another doctor.
And you've encountered those who don't believe. What are the things that you would say to them if they would listen?
Compassion and empathy makes the world go round. And when you say things that hurt somebody that can't control what's going on with themselves, you're a real crappy person.
True. That's
all I can say. Because everybody wants sympathy from me, but I can't get sympathy from my family. And it's sad. It's really sad.
And
it is.
What would you wish for your relationship with your family and your grandchildren if you could envision a future in, a year, 3 years, 5 years? What would be the best case?
I wish I could be more interactive. As an example, I went to my newest granddaughter's baptism. And it's a 2.5-hour drive. Driving's not fun for me. I drove up there, and I was the only family member on my son. It's my son's side that showed up. And it killed me to get there, but I wasn't missing it. And I stayed for 2 hours because that's all I could stay. I don't have anything to help me, like for pain meds or anything. I do use medical marijuana. That's the only thing I use at this point. But even then, it's not enough. And I left after 2 hours, and I drove 2.5 hours home, and I cried about 2 hours of it because it was that hard on me. My youngest daughter, Mom, come to the Petunia Festival with me in the town that she lives in. And I was like, okay, well, if I come, I might bring Grandma's walker because my mom had a walker that has a seat. And I'm afraid of going into a crowd because I don't want to get knocked over. I don't want to fall and pass out and get stumbled on. So I was kind of like letting her know, I might bring the walker so I always have a place to sit. And she's like, oh, nobody will care. And I said, I don't care if anybody cares. I'm just letting you know I might bring the walker because I cannot afford to fall down or get knocked over. I really can't. I'm still recovering from surgery. And I wish I could just be more interactive with my kids. I wish I could spend time with my grandkids alone. I used to take my oldest granddaughter, and she was with me constantly. And my new ones, I can't even pick them up. I can't pick them up. And that sucks. That really sucks. I don't have the relationship with my 3 youngest that I had with my oldest because I'm a different person. It changes you. Changes everything about you. I don't put makeup on anymore. Luckily, I have good skin. I mean, that's one good thing that I always had. My hair, I just don't like short hair, so it's always up. But I had to shave like that much of my neck off because that's where I sweat, and it just becomes a matted mess. And I have curly hair, so it turns into like dreadlocks. I don't worry about myself anymore. Physically, the physical appearance, I worry more about my medical standing than I used to. Used to be the opposite.
And it's because it has taken over, as you've said.
Yeah. Dressing cute isn't an option anymore either because I have to wear all soft, all stretchy. In the summer, I wear long sleeves because not that it's not 87 degrees right now, but because once I step outside of this vehicle, the wind blowing, which it's blowing, I could show you the trees, but I don't want to move the camera, hurts me. The wind blowing against my skin on my arms hurts me. It doesn't affect my legs too much, though. I mean, it's not as bad, I should say, to where it's actually really painful. It's uncomfortable sometimes, but I do wear a lot of soft, stretchy shorts in the summer just because they're easy.
Sure. And it allows you to function, right? I mean, that's the important thing.
Yeah.
Great.
I can't wear anything that it has to be stretchy. It has to be, I can't wear jewelry anymore. The only piece of jewelry I have on, and it's as big as I can get it, it's a medical alert bracelet, because they want me to wear one because I have implanted devices. I need to have notification if something happened to me, because they can't defibrillate me. So I tolerate it because if something happens to me, they need to know. But it's so big, I try to not let it touch me, and I tuck it under my shirt sleeve so it doesn't roll around and trigger me for pain. Yeah, I shoes, that's another thing. If I can't slide my feet into them, slippers, flip-flops, found the greatest new shoes, Kickits, Kikiz. If you cannot bend to put on shoes, they make a wonderful tennis shoe that you can put on without bending. Highly recommend it.
That's great.
First pair of tennis shoes I've had in a while. And boy, was I excited to try them. And they lived up to everything that I expected them to be. I'm just glad I'm not stuck in slippers anymore. I can wear tennis shoes. I mean, I'm wearing flip-flops now because it's hot, but it's nice to have something cover your whole foot instead of just the front of it.
Sure, absolutely. And it's just more comfortable in general, imagine.
And then also,
Lorri,
I don't know if you can see, but I have all sorts of stuff behind me to be able to drive. Pillows, all sorts of stuff. I have had to make accommodations in every part of my life to be able to just still function in the little I do.
And all of these things that you do, I mean, as you mentioned, the tips that you have for others, certainly, if you're comfortable with it, I could share your email with the video. If folks
absolutely share my email, thegrannyfromthechair@gmail.com. And I can promise at least once a week I'll have time to sit down and answer questions, and I have no problem doing that, because I wish I knew somebody like me in the beginning to help me, because I had to learn it all by myself.
Yeah, and
I really did.
Yeah,
the very hard way. If I can help anybody, I would love to help somebody.
Fantastic. Well, Lorri, I know you've had a long drive, and you probably have a lot more of the drive ahead of you today. I know that it's difficult for you even to do this, so thank you so much for taking the time. I can tell that you're fighting, and your spirit shines through, and your willingness to help others, which is exactly why Healthful Heroes exists. Really appreciate you sharing your journey today. I would love to stay in touch, and that future that you imagined with your family, being able to be more interactive. I'd love to hear about it someday. Maybe it's with the ketamine, maybe it's with something else.
We can do a follow-up if you'd like after the ketamine. I mean, yeah, I come back middle of August. I should have a good idea. I'll be back the 12th.
And if it works, then that would be a wonderful way to conclude.
Yes, because I wish I would have known about that a long time ago, because I've spent a lot of money when I had money. I still had a little money in the beginning. Trying all sorts of things, buying all sorts of pillows and things. It's an expensive disease too, because you gotta accommodate so much to make yourself comfortable, change everything.
So Lorri, thank you so much. Appreciate you taking the time. It takes me 3 to 4 weeks to edit video because it's just me right now. I kind of do it on the side of the.
No problem.
As soon as the video is ready, though, I'll share the link with you. You'll have it. You can share it with whomever needs to get educated. You want to share it with. It's an inspiring journey to hear what you're going through and what you've been fighting through. So thank you so much, and I look forward to staying in touch and to following up with you.
Because I'm really curious, because the people that I've talked to that have it are very impressed by it, and I'm hoping I am too. And if it could help another person, that would be great.
That's exactly why we're doing this. So, Lorri, thank you so much. Take care. Enjoy the rest of the day. Safe drive ahead of you, and we'll continue to be in touch. So I'll reach out in about a month's time, a month and a half's time.
All right. I appreciate it. Thank you so much.
No, thank you. Thank you. Take care, and great to hear you about your journey. Thank you again.
I appreciate you taking the time to listen to my journey.
Last time we spoke, you were just about to go explore a new treatment, you know? Sounds like it might have done something good for you. So if you could just describe the journey.
It was one of the best medical things I've done in my life. I was really nervous about the drive because I had to drive to Utah. I was fortunate that my primary care physician gave me a few small dose opioids just to make sure I'd get there. And I only had to take very little. So I was able to get there. I got there earlier than I thought. I allowed myself 4 days. I made it in like 2.5, 3. So I had a couple of days to relax and enjoy the scenery, beautiful country out there, surrounded by mountains. One thing that a lot of chronic illness people go through is being gaslit by their physicians, made to feel like a drug seeker, made to feel like it's psychosomatic or all in your head. You need to see a counselor because it's your depression or your anxiety causing it, which turns a lot of people off, from going to ERs, especially chronic pain patients, from just hearing it constantly from doctors. There's very few that will even listen to you. The experience I had there was totally unlike what I deal with here. It was beautiful. The nurse was great. My first day that I went, she was pretty nervous about my vein situation because I have vasoconstriction, intractable low blood pressure, orthostatic intolerance from my disorder. And I told her, we'll get all 10. We'll get all 10. I don't care if you have to put it in my eye because I need to do this. And we did it. I looked like I had track marks sometime when I was coming home, but we got them all, we got the 10. But the experience was beautiful. They were so accommodating. They listened to me. The nurse had never heard of my disorder. So she researched it the first night. And when I came in the second day, she was like, okay, this is what we're going to do. And she made a game plan. The room that they do it in is kind of dark because, a lot of people, you kind of hallucinate through it. That wasn't what it's about for me, on the mental health side for where it's keep treating depression and stuff like that. That's big. So what she did was she made accommodations for an empty office. They had a couch in there because she couldn't see to put the IVs in because my veins, I don't know if you can see, but you can't even hardly see my veins. Like I'm white as white, no veins. So she could have more light, more time to do me. To get my IV in. They were worried about how, one thing about ketamine is everybody tolerates differently. So the first infusion I had was 80 milligrams and I tolerated it just fine. So the second day I went to 95, tolerated that just fine. Then I went to 125, tolerated that fine. And then 160 on Thursday, did good on that one. So 200 was what we were, they go by your body weight and your tolerance. 200 is the max they would go. So for 6 of the days I was out there, I did the 200. After day 1, I had no pain I had no pain until I went to sleep. I woke up, I was stiff again, which is normal. Second day, same thing, no pain after. Next morning I woke up, still no pain, but I started to feel kind of yucky before I got there in pain. After that infusion, I haven't had, I don't want to say pain, but to me, CRPS pain, not having that is no pain. I mean, I still have 50-year-old aches and, stuff like that because of my age, but I don't have the non-stop, constant burning pain, aching, not wanting to move, laying in bed, sitting in a recliner kind of pain that I lived with for 6 years. And it's just a beautiful thing. I might get emotional because I've been very emotional, but I feel like the old me, and that is the greatest thing ever. I mean, I feel like I could climb a mountain, which I obviously know I can't, but I was able to, I didn't have it on the weekend. I was able to go to Bridal Veil Falls in Utah. I had read about it. It's a paved path. It's about 1.4 miles up to the base of the falls. And I thought, I have time to kill before I have to check into my next Airbnb. So I went there to see what I could do. And I mean, I was able to sit on benches, but I made it. And I can't walk to my mailbox, or couldn't walk to my mailbox before. I didn't realize how long my hair was, because for years, my daughters have just been putting it up in braids or messy buns because I couldn't do it myself. I didn't even realize it was this long anymore because it's been up in something for years. I mean, it took me all day because, I mean, I'm out of shape. I haven't done much but lay in bed and be in a recliner for a long time. But today I was able to clean my bathroom. You know, that's something I haven't done in a while, is do any cleaning. I have a PA that does it, but, you know, I got back and it needed to be done. So I was like, okay, I'm doing it. And I just did a little at a time. I did counters, and then I took a break. I did the toilet area, did a break. Tub area, did a break. Mopped the floor. You know, I did it in stages, but I got it done. And that feels good. That feels really, really, really good.
That is fantastic. And so
Yeah.
Going back to the ketamine, you know, I'm trying to remember, how did you stumble upon the idea for going for the ketamine, and sort of what was that process like finding out about it?
I had been on opioids for a while, but I didn't like them. I didn't think they worked very good. I didn't like having to sign a pain contract where you have to take them as prescribed, because I don't take them like some days I need more, some days I need less, if that makes sense. It depends on if I'm in a flare up. And it was just, I don't feel like it helped me. I had done all the treatments, the radiofrequency ablation, stellate ganglion blocks, caudal shots, sacroiliac joint shots. I have 2 implanted nerve stimulators. I mean, if they say it would help me, I've tried it. All different kinds of anticonvulsants, you know, gabapentin. I was on duloxetine, amitriptyline. I'm on Lyrica. I mean, I've done all the medicines, and I just didn't respond to them. So I started to think that there was nothing that would have helped me. And I started to look into physician-assisted suicide because I couldn't live like this anymore. So, but I still kept going because I knew that I needed to give it more time. And I just am always researching different things. I'm on all kinds of forums, online, talking to other CRPS patients, RSD. A.org, which is the CRPS website. It used to be called Reflex Sympathetic Dystrophy. So it's still got that website. I watched all the videos from like Dr. Pratik Chopra, Dr. Philip Getzum, and they all mentioned ketamine because basically with CRPS, it's your central nervous system, parasympathetic, sympathetic, and your NMDA receptors are in your nervous system, and basically they're going crazy and sending out your glial cells, which are kind of like the immune system of your central nervous system, and they're sending them to attack you. So what it does is it settles down the NMDA receptors, and that settles down the glial cells, and it kind of puts you in remission. Unfortunately, it's still experimental, and I'm still pending, waiting to see if I'm approved for Social Security. I mean, I've already had the hearing, I'm just waiting, and I didn't know how I'd pay for it, but I have a wonderful aunt and uncle that footed the whole bill. I mean, every bit of it.
That's wonderful. That's wonderful. And I know that was always a concern, and that's why you had sought out help in Utah, right? It's a far drive, but it was affordable.
Right. Here in Illinois, when I originally started doing the research, like in by Chicago, there was a doctor. I'm not going to name his name because it was a very bad situation. I was treated very crappily, and I didn't even see him, just trying to make an appointment. But I was basically told you can't afford it because it's $900 a session. And, you know, the protocol, it varies by who you talk to, but it's either like 5 days in hospitalization or 4-hour infusions for 5 days. But I couldn't afford that. So I went with the 10 infusions over 10 days, and I came home with ketamine troches, which are sublingual to keep it going, you know, because maintenance doses are required. Every person's different, anywhere from 4 to 12 weeks. And I'd already asked about the ketamine troches here, but I couldn't find a doctor to prescribe them. So they're like, well, we'll prescribe them. I mean, it was just such an amazing experience out there compared to here. I mean, I have begged doctors here, you know, for things that they say will help. And, you know, they just, sometimes they treat you like you're crazy or drug seeking or whatever. And people just want help. And it was just beautiful. The difference, like, Illinois needs to do better now that I've experienced it out of state. That's all I got to say. I knew I couldn't afford the $900. I had tried to place, I found a listing of all the places that do ketamine treatments. Ketamine's mainly used for depression right now, but they're dabbling in chronic pain. They did some clinical trials with it, showed it helped. So I got this list off the internet, and I just started calling all the states close by that was affordable. I found it for like $400 in Michigan. Would have saved me money because of the drive and the lodging. I could have, you know, probably did it cheaper. But when I called to make the appointment, I was told that because 4 people from Illinois didn't show up, they won't take any out-of-state patients anymore. And I'm like, I'll prepay it. I mean, I'll pay it before I come. I mean, I need this. But they still wouldn't do it. And then I just knew Utah was far away, but it was the cheapest in all the United States that I found. And my hands were kind of tied. So I took a chance, and it was the best decision of my life.
Wow,
Hands down.
Phenomenal.
Hands down.
And so
Yeah.
you still have the stimulators. Are they helping still? Are they still part of how you're managing?
They help a little bit, but they don't help. I mean, I can, like, my lumbar one, I can tell specifically, like, if I have a bad back pain, the first thing I check is to make sure my battery didn't die, because I feel like my lumbar helps more than my cervical, because that one was put in first, and my cervical was put in a little late. And I think it was just too late to make a difference. Some of the doctors say that once you're 3 years in, they won't help you. And it was after 3 years in. So I really don't notice a big difference if my cervical one dies. I definitely do with my lumbar.
And so even after the ketamine.
Well, I haven't let it die, so I can't really say fully. I mean, that happens when I'm really busy, you know, and I just forget. But I haven't let it die yet. So I can't speak on that at this point because it hasn't happened. But yeah, it's great. It's great. I have hope again. I lost the hope. And that's what kept me going for 5.5 years, you know, was the hope. But then when they said there's nothing more they could do for me, and I couldn't get the stuff that is still experimental, and all of the stuff that's out of pocket, and, you know, still waiting, and for Social Security, it was just, I didn't think I had any more options. I really didn't. And then my aunt, when she found out I was looking at a physician assisted suicide, she said, me and your uncle are going to pay for this. We're going to pay for it. And I said, I'll pay you back. I will. And then I was just going to sleep in my van because I didn't have the money for like that. But then I found out there was this big heat wave out there, and it was 104 one day. It was terrible. At least it was dry heat. And then she called me and she says, you know, I've been thinking, I don't want you sleeping, you know, in a strange area by yourself. And I'm like, I'm not worried about anybody hurting me, Judy. I'm not. And she says, I won't be able to sleep at night, so I want to get you a hotel. And I said, don't get a hotel. Let me see what I can find on Airbnb. They're cheaper. I couldn't find one straight through, so I found a couple. You know, there was 2, and then one night in the middle that I had to stay in a hotel because it's Provo has Brigham Young, I think it's Brigham Young University, and everybody's coming back to school, so a lot of them were full. But I made do. It happened. So she sent me $1,000 to buy the Airbnb and to have a little extra money because it would make her feel better. I just owe them so much. I mean, more than money. They literally saved my life. Literally.
Fantastic. And, you know, they listened to you first, and then they shared what they could, and they wanted to see you get better. That's a beautiful thing.
Yeah. I'm their only niece. And, you know, they know I did what I could to take care of my mom, and I was always helping when I could. When my other uncle died, he had two young boys. I took in one for a little while, but it was just too much for me. But I always try to help other people. And she said, "You always try to help other people, and I want to help you." You know. And she saved my life. She literally saved my life.
That's so great. You know, that's the thing. She doesn't realize perhaps how much of an impact, and you know, you can share
She
this.
does. She does. I every day I called her because she worried about me, and I'd call her every day and tell her how I felt and tell her what happened, you know, like how it went. Was I feeling pain? And every day, you know, not only did the ketamine help my pain, but I was so depressed because of the pain for so long that I started to think clearer. I was very emotional. I'm still kind of emotional because I got all these feelings that I repressed for so long because there was nothing to be happy about. And I made her cry a couple times when I'm like, I literally can't thank you enough. I will repay you. And they even told me, you don't have to pay me back, but I want to, you know, I want to because it's the right thing to do, you know, when I get in a better situation. And she knows how much I care and how much I appreciate them. They know it.
That's fantastic.
They know it.
You know, you had mentioned previously that you had struggled with your children and your grandchildren, sort of being able to be there for them because of the pain. Have you reached out at all since?
I was in communication with my kids. My grandchildren, I've only got one I have one that's 8 and the rest are 2 and almost 1. So I have a lot of small grandchildren. I haven't seen them since I got home. I just got home Sunday. I slept, you know, because Airbnb beds aren't my beds. I have a nice mattress because I have scars all over my back, and I can't take many mattresses. So I was very happy to be home and to sleep in my own bed and to get some good sleep. I just kind of took it easy yesterday, and you know, I haven't seen them yet, but I've been in contact with them, and they're all just very happy. Like when I told my daughter that I feel like the old me, and she says, "Oh, Mom, that makes me so happy." You know, because I used to be such a happy person and, you know, fun person, and I turned into a recluse that didn't get out of bed or out of a recliner, and caused a lot of problems too, you know, with me and my kids, because I went to my granddaughter's baptism in another state, which was 2.5-hour drive there, 2.5-hour drive back. I couldn't stay longer than 2 hours. I couldn't stay longer than 2 hours at my daughter's birthday party. I mean, because the pain gets so bad, I can't take it and I have to go home. So I feel like I could do it now. I mean, I don't know how long this will last, and I really hope I get some time like this, because there's so many things I want to do. You know, so many things I want to do. And I'll make the drive again if I have to, and get whatever I got to do, because it's worth it.
And so you're remembering how you were, you know, 6 years ago, and the types of things that you would do. What are the types of things that you want to do now that you're better?
Well, I can't do what I used to do because I was an adrenaline junkie and a tomboy. I grew up in the country. I used to ride motorcycles, bungee jump, paraglide, parasail. I mean, I was just a big adrenaline junkie. I used to drag race. Obviously, I'm not going to do anything stupid I don't consider it stupid, but I won't do anything that crazy anymore because I know if I hurt myself, it's going to be terrible. I mean, just be social. Like, I lost the majority of my friends because I didn't want to be around them, you know, because I was just so miserable. There's so much I want to do. Like, just be social, spend quality time with my family, not where I just am looking at my phone saying, I got to go, you know, because I make myself stay the 2 hours, you know, but it's killing me. I just want to live again. I want to live again.
And I'm very happy for you as well, right? This is your chance. It worked.
I mean,
thank goodness it worked. You know, because I remember our conversation. You know, it was a very tough place. Nothing had worked. You had been living with for many years, and this was kind of maybe the last hope. And
this was my last hope. I put all my eggs in this basket, and I'm so glad I did. I really do. I really you know, it's life changing. That's the best way I can describe this. Life changing. And you know, I feel like, you know, I need to do something like advocate, write senators, write the governor, you know, tell them what I've been through and why can't this be available here? Why can't this be covered by insurance? You know, I mean, it's life or death with this disorder sometimes. You know, when you get to a point where there's nothing else left to try and it's all out of pocket, and you haven't worked in 5 or 6 years because of the disorder, what are you supposed to do? I was fortunate. I was fortunate that I had family that believed in me because they know what I used to be. You know, 6 patents, area manager for Verizon, doing everything. I mean, I had a decent life. And it was all taken away from me. All of it.
And you have that perspective. You knew what it was like before. You knew what it was like while you were living through it. And now hopefully you never have to go through that again. Hopefully this is it.
I will sell off everything I own to keep getting these treatments, the maintenance treatments, which are, you know, I don't know how long it'll last for me, but everybody's different. But God, I hope it's at least 2 months. That would be great. 3 would be awesome. You know, I can get them here for $500, but I don't think I can get the ketamine troches that extend it, like sublingually. You know, when you have a flare up or weekly, you can take them, but it's to extend between the maintenance doses. So if I have to, I'll drive back to Utah because I know I can get it there.
Well, it sounds like you have an opportunity to advocate, as you mentioned, so that hopefully you can get it in Illinois, so you don't have to make that drive, because that is a commitment as well. I mean, 4 days is a long time to be on the road, and then maybe you can make it in 2 now that you're able to.
I made it home in like 1.5 days.
Oh, well, see, there you go. That is.
So I mean, that tells you the difference. It's
Wow.
life-changing. And you know, I just really think that the youth healthcare system should cover something if it helps people. Yes, I understand, you know, it could be expensive. I mean, but they're willing to put pay $100,000 surgery to put a spinal cord stimulator in me, but not pay $500 every 2-3 months to get an infusion. I don't get it. You see what I'm saying? And I've had 5 revisions on my spinal cord stimulators, and every time it's tens of thousands of dollars if they do that. And it's never got me this good. I mean, it just took the real edge away, you know. You shouldn't have to decide between whether you want to eat, live, have a place to live, or survive so you can pay for something that makes you feel like you can survive. That's why people commit suicide with chronic pain, because they don't leave you a choice. They don't, you know?
And part of what we're doing today, right, in this conversation, the one thing that I reflect on is that it's so difficult for us to put ourselves in another person's shoes. It's
Yes.
just part of the human condition that we don't truly understand something unless we've experienced it. And so
No.
hopefully by you just sharing your journey, well, there are a few things that I hope happen. Number one, I hope someone with CRPS sees this video who hasn't tried ketamine and gives it a shot. Because the worst that can happen is it's just another one of those things that doesn't work.
Exactly.
But if it does, the transformation that you've experienced, I mean, it's a world of difference.
It truly is. You know, it truly is. And I mean, I don't think I'll ever be in like good enough shape, because I have other things that go along with it besides the pain, like the orthostatic intolerance, excessive sweating, you know, stuff like that still prohibit a lot of the things I do. But not having the pain is a beautiful thing.
Wow. And honestly, when we talked last time, I wasn't sure it was going to work either. You know, I think we all
I
can.
wasn't either, but I didn't want to get too excited because I'm always let down so hard when I think I could have a shot at life again, you know, and then it's just a disappointment. So on day 3, I knew by day 3 that this was going to help.
Wow.
I did.
That's fantastic. That's absolutely fantastic.
And here, let me tell you a funny story.
Sure.
So May 17th of this year, I had a spinal cord stimulator revision again. And after doing all the stuff, listening to the doctors from the RSD and on YouTube, you know, surgery can exacerbate your situation. And they all say, well, not all of them, but the top ones say, when you have surgery, you need to have ketamine as part of your anesthesia to help stop the spread. And they say average is like 100 to 125. So I had to fight my surgeon until he finally said, yes, I'll tell the anesthesiologist to give it to you. And when I got there, the anesthesiologist didn't want to give it to me. And he said, I can't give you 100 during this surgery. Well, now I know that I can take 200 in an hour. So I'm not going to listen to that crap again. Excuse my language, you know, because now I know I can handle it.
That's fantastic. Well, and you know, it helps. You know, it helps.
Yes. Yes.
Wonderful. And that's the thing about pain too, right? You're the ultimate judge of whether or not it helps. No one else can tell you what helps and what doesn't. So.
And another good thing that has happened, like everybody has said, you stand taller, you walk better, your color's better. I did on the phone appointments with my counselor while I was there. And once a week I talked to her. And the first week she called me and she says, how are you doing? I said, I'm doing good. And she says, I have been dealing with you for 6 years and I've never heard you say you're doing good. You always, I'm okay, or I'm on, you know, whatever. And she said, that is wonderful. And then the second time she called, I was like, I'm doing fabulous, because by then I was doing really good. And she's like, I am so happy, you know, because she's been there for the whole thing. Like me saying, when I didn't know what was wrong with me and I just don't understand why it hurts so bad. And I've had this surgery and they say this will help and this will help and none of it's helping. And then, you know, I got the diagnosis and, you know, I mean, she's been there through the whole thing and she's just very happy that something finally worked. I talked to her about the physician-assisted suicide, and she says, I understand why you want to do it, but just hold on. And you know, everybody told me that. And I'm glad I did. I really am.
And now you have the next many, many years to enjoy this.
At least, I'm hoping at least 20. I'm 50, and if I get 20 good years, I'll take it.
That sounds wonderful. It's all we can ask for, really, is to live that full life pain-free, hopefully. And
yes. And it's just one day at a time. Like I said, I might wake up tomorrow and be back in pain. I don't know. But every day I get makes me happier. Every day I get makes me happier.
And it kind of comes through. Your energy just in this conversation is it's night and day. And so congratulations. This is exactly the type of story that needs to be shared.
Yes, because there is hope out there for people if it works for them. I mean, and I've been one of those who lost hope because I tried everything and it just didn't work. Everything. Even, you know, I mean, like I said, I did it all. Surgery, shots, opioids. I did them all. I did Lotus Naltrexone, which is used for alcoholics and drug addicts. But at a low dose, it can trick you to feel the pain. I mean, if they tell me it would help, I tried it. I never turned anything down because I just wanted to be not even normal, but be okay. Yeah. You know, I know I'll never be normal again just because of all the surgeries I've had and all the joint problems I have. But I'm going to be okay if I can keep this up. And that's a good feeling. Yes.
So Lorri, I would say this. Thank you, of course, for sharing your journey.
Thank you. And if anybody wants to reach out to me, I would be happy to talk to anybody if they've got any questions, other things to try besides ketamine that I've tried. I'll tell them my experience. You know, I'm open to helping other people because that's how I've That's how I was raised, was to be a good person.
So thank you. That's, and I actually believe that there are many folks out there who, exactly as you said, raised to help others. It's part of who we are. That's
Yes.
why hopefully the organization exists, to enable folks like yourself who've been through the worst of what folks can experience, have come out the other side and can share, because there's information. And yes, it was tough to get that information because you had to live through it. But if there's a good result at the end, then
all I want to say as like a leaving note is, yes, doctors are good. Some doctors are good. But if you know something's wrong with you, don't give up until they figure it out. Don't keep hearing no and just giving up. You have to keep pushing on, because there is hope if you keep trying. Don't give up. And I wanted to give up, but I'm so glad I didn't. Don't give up. Just never give up. There's always something, or something will come around.
As you sit before me right now, I see someone who has struggled, who has fought for themselves, who has advocated for themselves, who has done the hard things, accepted money from family. It's not the easiest thing to do, but you did it because it might help you. And so congratulations. That's all I can say is congratulations. Thank you so much.
Thank you.
Thank you.
And if me telling my story, even though it took me 6 years to get to this, more than 6 years to get to this point, and it gets somebody there quicker, I know that's doing a good thing, because they don't have to go through as much as I went through, because I had to learn as I went, figure it out as I went, trial and error. Hopefully I can help somebody get there quicker than me.
Absolutely. I am.
And less surgeries.
Yes, of course. Yeah, the less we have to do to get there quicker. I reflect on 20 years of living a 30% life, and it's just a shame. But I could sit here and I could just say, okay, well, that was it, and do nothing with it. I have the information now, and now my life is better. Or like you, I could share my story. So
yes,
what we're
because
doing.
it might help somebody else.
Exactly.
That's the most important thing, is if this helps somebody else, it's the right thing to do.
When you're healthy again, it reveals how good you were, and it really was the illness in a lot of ways.
Yes.
That wasn't who you were. That was what you were managing through.
Yes, and that's what my kids say, that I just turned into such a cranky old lady because I was in so much pain, that I was always cranky, never happy, never nothing. And my daughter said, it's nice to hear your voice happy, because it was on the phone. She says, I can tell by your voice you're happy.
Absolutely. I can tell. I can absolutely tell.
I mean, I might be a blubbering idiot, but it's because
not at all.
Just so happy, a happy feeling that I don't know how to not be emotional about it, because I literally thought my life was over, and now I have hope.
Very few folks get to this point of, in their lifetimes, knowing what redemption feels like. Very few.
Yes.
So there's a feeling of good fortune just in that moment where you realize, wow, most of the time it's a decline until the end.
Yes.
Well, now we've got another shot at this.
Yes, and I was at my end. And that's what's so great. That's what's so great, is because I had given up. Not 100%, but I, before my aunt was going to said she would pay for this, I had given up. And then when she said that, I just had to wait and, get the appointment set up and make it to the dates I had to go. So I'm so glad it happened this way. I really am. And I am in more ways than one indebted to my aunt and uncle, Judy and Denny. Great people, love them dearly, and they saved my life.